Okay, well, welcome everybody. We want to thank you for zooming in today and seeing our presentation. This presentation is really going to focus on returning to work in a COVID-19 environment, what that means for you, what that means for your students, and how we all work together as a team to really keep us all safe. We want to introduce our team here that's on the Zoom meeting this morning with you. My name is Jody Dumas. I'm the Assistant Superintendent, Chief Operating Officer for the district.
Hello, everyone. I'm Susie DeBose, and I'm the Supervisor of Health Services for the district.
Hello, I'm Al Hereda, Employee Relations and Equity Administrator.
Hello, I'm Lynn Peterson. I'm the Supervisor of Risk Management.
So thank you, everybody, and thank you for the team that's helping put this presentation together for you today and doing this. And what we talked about as a team is, as we presented this to you, we were just going to kind of team up. So you'll see as we go through this presentation, we'll kind of all work these slides together to make sure we're providing you the most up-to-date information that we can in terms of COVID-19, health and safety of you, your students, and all of us, again, here in the district. One of the things that we want you to know before we get into the presentation is that we've been working very, very closely with the Department of Health for the last several months. And so everything you're going to see here really is based on our conversations with them, based on what the CDC has put out for reopening schools. So they're really guiding all of the information here. And our relationship with them is a very close relationship. And we talk with them daily. And you'll see as we talk through some of the processes that we're going to describe here, in this presentation, that they're going to be involved on a daily basis and helping make some of the decisions that we're going to need to make as a district as we move forward and open with students on August 31st. The other thing I'd like you to know that in addition to the Department of Health, we as a team have also met with a group of local health officials from local hospitals, doctors, specialists in the area of diseases and prevention and epidemiology. And so they've also advised us in much of what you're going to see here in this presentation. So we've really tried to make sure we pull as many resources as we can to the table as we develop our plan moving into this year. The other disclaimer that we'd like to put here, though, is that one of the things we learned really early on, with COVID-19, and we're still experiencing every day, is information is changing. And so this presentation is as up to date as we possibly could get it for you. But please understand that things may change as we move forward. Certainly the amount of community spread of COVID-19 is going to change over the time, although right now we are in a downward trend. That's great for the start of school. That's going to change over time. And so we may have to make some adjustments. So again, understand that we're working with the Department of Health very closely, and as things change, we'll continue to update you on those changes. So our agenda for today, we've got a robust agenda, and we're going to try and make sure this is as comprehensive as possible. So you can see I'm not going to read through the agenda, but these are the areas that we're going to try and touch upon as we move through the presentation. At the end of the presentation, we may not have answered all your questions, and so our last slide will contain an email address that you can email us, and we'll make sure that those questions are responded to in a timely manner. So with that, Susie, let's talk about what is coronavirus. What's COVID-19?
Okay, thank you, Jody. So we've been living this for a couple months now, and I would suspect that most of us are familiar with the signs and symptoms. Most of us also even know that some people are asymptomatic, and there's some concern about those carriers of the illness because of their ability to spread without knowing it. When we're looking at going back to school and work, we're asking staff, if you're not well, stay home. If you're not feeling well, don't come in, because we're not sure what it is. At this point, medical professionals are erring on the side of caution and saying, because there are so many vague symptoms or general symptoms that mimic other illnesses, we really need to make sure that we're not contagious before we would enter the work or school site. That having been said, there are a few symptoms and information that you need to know, which is why it's so important to follow etiquette and use PPE. COVID is spread person to person. It's primarily a respiratory disease. We have seen that it can live on different surfaces for various amounts of time, which is why we're putting all of those cleaning procedures in place, hand washing, use of hand sanitizer, third time's a charm. But again, people don't know if they're asymptomatic. So that's why we're going to talk a little bit more again today about how we can protect ourselves and others. The big push, as you'll see in the media and from medical professionals, is that all students and staff should wear a face covering, okay? We're also going to talk about other mitigating factors, frequent hand washing. I know my son, he used to use the ABC song as a proper amount of time, that 20 seconds. Boy, that kid could do the ABC song faster than anybody I knew. So it required training. This is why we're doing it. This is, we like to say, keep saying it's a culture. Let's make this a culture. Let's make this habit. That's why we keep talking about these things, so that we're more comfortable with it, so it becomes a habit. So we just, when we go to the sink, we're more conscientious, we'll do the 20 seconds. We won't sing that ABC song, you know, in 3 seconds flat. Another important factor is social distancing. We like to ask that you are at least 6 feet away. If not, please keep it at brief interactive periods, okay? Important to keep all of these factors in mind. We're going to be asking students and staff to clean surfaces, clean touch points. Don't touch your eyes, your nose, your mouth. Those are portals. That's how viruses get in. So I know that a lot of us are working on adjusting masks and getting used to them, but we'll get used to them. Just be mindful. Use the mask as a reminder not to touch your eyes, nose, or mouth. How about that? And again, if you are sick, please stay home. And we'll talk more about what that looks like.
Thank you, Susie. And I really like what Susie did, is she described it as creating a culture. And so that's really, you know, I think a part of this presentation today is really asking you to be part of that team creating the culture across our district, a culture of safety, where we really focus on each other and we really focus on social distancing, wearing the proper PPE, and that's going to be key moving forward. So I think that's just got to be part of our daily lives. And certainly we cannot be at every site every day. We're going to have you all be making sure you're constantly paying attention, and whatever we do throughout the day, that again, the culture of safety is really foremost in all of our minds. And so I'll say that too, and Susie mentioned social distancing here. That's going to be key moving forward. We're going to talk a lot about that. But in terms of if you're a teacher and you've got a classroom, that's the first thing you should be talking about and thinking about when you set that classroom up, is trying to maintain as much distance between the students and yourself in that class as possible. So when you set that class up, please make sure that if there are things that don't need to be in the classroom, let's get them out of there. Let's start with pushing the desks as far apart as possible. And again, trying to maintain as much as possible that 6 foot between everybody. We know we can't maintain that in all classrooms, but we need to strive for as much as possible. So social distancing, being able to maintain that social distancing, we think needs to be kind of the overarching umbrella and overarching theme of everything we do throughout the district. But the other piece of protecting not only yourself, but everybody else is PPE. So the next thing we want to talk about is, this is a little video we were able to put together, and this talks about the types of PPE that we have available for you. So let's watch this quickly, and then we'll talk a little bit more about PPE.
My name is Jody Dumas. I'm the Chief Operating Officer for Sarasota County Schools, and I'm here today to talk to you about personal protective equipment and what we're doing for all of our employees throughout the district to make sure we can come back to school in a safe environment for not only students, but for our team of talented individuals that teach classes on a daily basis. In terms of personal protective equipment, we really tried to run the gamut of everything that our employees could need throughout the day in a classroom setting or in their work setting. We've got all types of face masks that we've run into our warehouse that are available to employees, from cloth face masks to disposable face masks, some adjustable face masks. We want to make sure employees are comfortable wearing a face mask, because at the end of the day, we know a face mask is one of the most important pieces of PPE that an employee can wear in a work environment. Some employees may want to wear not only the face mask, but a face shield in addition to that. If they like to do that, we have that and can provide that to them. we're also requiring a face covering of all students. But in addition to that, we've purchased for every student a desk shield. That's going to go on every student's desk. And that just provides an extra layer of protection so that should a student sneeze or cough, that shield is going to help provide extra protection. We've also purchased some trifold desk shields that we can give to social workers and psychologists. We've got those available, so you make sure you've got that extra barrier of protection between you and whoever you're working with. We've got gloves stocked in the warehouse. We also have stocked gowns. So in terms of some positions, like an ESEA that has to come in close contact with a student, they might elect to wear a gown during the day. We've also got hand sanitizer in every space throughout the district. Certainly we want to encourage hand washing as being the primary way to do that throughout the day. But if you're not next to a bathroom, the hand sanitizer is the next best thing. We also have Alpha, our disinfectant, located in every space in the district, whether it's an office or a classroom. We're providing that to employees so that they continually disinfect their space throughout the day. At all of our school sites, we've got a single point of entry, and we know that as we come into that front office area, parents are going to be contained. They're going to have to make appointments to come in. So we've got those protectants for our employees who are up right in those front office areas. One of the things we really want to focus on is social distancing. No matter what type of PPE you have on, we feel that trying to maintain a safe distance between other employees, other teachers, students, really needs to be the focus throughout our day. We know that's not going to be easy, and that's why face coverings are so important, particularly face masks. So how do you get this PPE if you run short in your classroom? We're fully stocked in our warehouse. All of your bookkeepers at all of your sites have a COVID-19 order form coming from the warehouse. And so what you would do is you communicate to your bookkeeper at your site that you need masks, you need face shields, you need gowns, whatever it is you think you need that we have. The bookkeeper will order it directly from our warehouse. It'll be shipped over to your site and be delivered to you. One of the biggest things we know with personal protective equipment is it's got to be used properly, it's got to be fitted properly for it to be effective. So the first day or two of your return to work is going to be focused on safety and training and how to use PPE properly. We want to make sure that not only do you have it, but it's fitted well to you, you know how to use it, and you're protecting yourself as well as everybody in your classroom. Our promise as a school district is to make sure we're doing everything we can to make those environments as students come back to school and teachers come back to teach as safe as possible.
So thank you very much for watching that. Again, really the point of that video is to talk about the available personal protective equipment, or PPE, that we have for you as an employee in the district. Again, it's our goal to make sure that whatever you need in your spaces, we can provide that to you. So you kind of saw the video that gave the list of what's available. Please see your bookkeeper. If there's something additional that you need, they can order that from the warehouse. And if there's something that you don't, that you need that you don't have, make sure you talk with your supervisor, your principal, and they'll get that information to us, and we'll take a look at what we can do to help take care of that for you. So please make sure that you got the proper PPE, make sure you're wearing it correctly, and if you got any questions on that, let us know. Wanted to talk a little bit about the face covering policy, because that, again, as we talk about protecting each other and a culture of safety around the district, again, that overarching umbrella needs to be distancing, 6 foot of distancing between everybody. But the PPE is kind of that second layer, right? That face covering. And so what does that look like? Remember, we started this presentation with all things subject to change. And so as we do this, it's Friday before you're coming back to work. And we have adopted a face covering policy, our board has, and I'm going to talk about what that looks like with you. But understand that our board meets next week, actually on the 18th, I believe, and they're going to reconsider this policy. So we're going to tell you what it says today. If that changes, we'll have to re-update you, but this is kind of where that policy exists as we are. Basically, what the board has done is said that everybody in the district, including students, staff, visitors, anybody coming into our sites, has to wear a face covering. And they define that face covering in a couple of different ways. Basically, commercially produced surgical masks, respirators, or face shields, or commercially produced or homemade cloth face coverings, provided that they cover both the mouth and the nose and fit snugly against the sides of a person's face with little and no gaps. At the end of the day, we've given cost center heads and principals the authority to make the determination on, does it fit our definition of a face covering or not. And then we also gave the option that as we look at PPE, certainly one of the things that we have basically our mask type face covering, or we have a shield type face covering. As you look at PPE, layering PPE is very, very important. So if you wanted to look at how you would most protect yourself and others, that might be a face shield and a mask. And so this allows that in addition to just wearing one or the other. That's the piece of our policy that I think our board is going to consider next week. Right now, it does allow a face mask or a face shield. Either would comply with this policy. I believe the board will be asking the question, do we want to allow a face shield, or are we going to make a face mask the preferred method of a face covering? So we'll see how that all plays out, but right now we do have options in terms of that face covering. So if you have any questions, it is a school board policy. It's an emergency policy. It's in place for 90 days. And if that changes, we'll let you know what that looks like. This is an example of some face masks and face shields, face coverings that would be certainly allowable under our policy. We have a few of these available in our warehouse. We have the disposable masks down on the left of your screen available. We have the cloth masks available in the warehouse. Up on the right-hand side is a N95 mask or a KN95 mask. That's the higher level. We call those respirators. That's really what would be used in a hospital environment. We do have those available also. They're very difficult to wear. They're hotter, tougher to breathe through, but we do have them if you'd like them they're available in our warehouse. And that's part of what our clinic aides and our nursing staff, they'll be outfitted with the N95s or the KN95s to make sure we're providing the utmost protection as potential cases of COVID-19 may show up in our clinic. And then on the bottom are example of a few face shields. We have those also. Again, this PPE is all available through our warehouse, but if you have personal items that resemble these that you'd like to bring in, certainly we're encouraging those items to come in too. If you have a certain type of cloth mask that you prefer to wear, you can do that as an employee also. Now, one of the biggest things, once you decide what type of PPE you're going to wear, it's wearing it correctly. And so in this next video, which we're going to move to, Susie actually talks about how you actually wear a face covering correctly.
Hi, I'm Susie DeBose, and I'm the Health Services Supervisor for Sarasota County Schools. I'm here today to talk a little bit about the safety measures that we're putting in place so that we can welcome everyone back to the school and work sites and keep them healthy and safe. When we're looking at risk associated with COVID transmission, COVID is primarily a respiratory disease and can be spread by people who do not have symptoms and do not know that they are infected. CDC recommends all people 2 years of age and older wear a cloth face covering in public settings and when around people who don't live in your household, especially when other social distancing measures are difficult to maintain. Our school board has passed a policy that requires all students and staff to wear a face covering. So if you are students or a staff member in a classroom, you are wearing a face covering. If you are a staff member that has a private cubicle or office space, you are permitted to remove the face covering, but we ask that when you transition to another space or you walk out of your area, that you put that face covering back on. Wear a face covering that covers your nose and mouth to help protect others in case you're infected with COVID-19 but don't have symptoms. Mask is one such face covering. Masks can prevent you from touching your face and can be a visual reminder to practice social distancing. Wear a face covering correctly for maximum protection. Don't put the face covering around your neck or up on your forehead. Don't touch the face covering, and if you do, wash your hands or use hand sanitizer to disinfect. All staff will be provided with cloth masks in a pack of 5 so that they have one for every day of the work week. Before you put your mask on, wash your hands, and if soap and water are not available, use hand sanitizer. Pick up the mask by the loops, carefully loop the straps over your ears and make sure the mask fits. When removing the mask, grab it by the loops, pull it away from your face, careful not to touch your face or anywhere else on your body, fold the mask in on itself, and then drop it in the laundry basket or wash it according to CDC guidelines. If you prefer a disposable mask, those are available for staff as well. Pick up the mask by the loops, put the white wire flap at the top, adjust the mask so it fits your face, and then pinch the wire so that it's fitted around your nose. To remove the mask, take the straps off your ears, careful not to touch your face or the rest of your body, and discard it in a proper receptacle. We do have shields available for staff. The CDC does not recommend a shield as a replacement for a mask. Unless it goes below your chin and wraps around your head, they recommend a mask as well as a shield. The district is requesting that all students and staff wear a face covering. If a student is more comfortable with a shield versus a mask versus a gaiter or scarf that they can pull up, those are all options. A mask may be the difference between exclusion and being able to continue with your daily routine. If you are wearing a mask and maintaining social distancing, then you are at lower risk of transmission than the person who is not wearing a face covering.
All right, awesome job there, Susie, talking about the proper wearing of your PPE. And again, fit is absolutely essential. You got to make sure that the fit is correct on your PPE for it to be effective. So a couple of comments about our mask policy. So you may be thinking that, okay, everybody's got to wear a face covering. What are we going to do for students if we got to give them a break? Our policy does allow for that. So if you can take your class outside and they can socially distance, students can, and you can remove your mask outside the building as long as you can socially distance. What I would say is definitely check with your building administrator, your principal, about what's the definition of outside, because I know some schools have courtyards, and those are not going to be considered outside. We're talking out in play areas and grass fields. That's where students and yourself can remove that mask. In addition to that, if you have planning time and you can be in your room by yourself, you're also permitted to take that mask off at that particular time. So those are some exceptions. The other exception is what we're calling a medical certification. So as the board was considering a face covering policy, one of the things that they knew we had to consider is that some people just medically or physically, whatever that might be, cannot wear different types of face covering. So we have provided for that certification within the policy, and so that will require, whether you're a student or an employee, to go to your doctor, your psychologist, whatever that may be, your medical provider. They're going to have to fill out that exception certificate for you, for the student, and I'll have to come back to the school to be approved. And so for those students, in some cases, they may not be wearing masks or face covering, and we may not have employees wearing masks and a face covering. One of the things that we've wrestled with, to be honest with you, is how do we identify those students? So if we are in school and we've got kids walking through the hallways during transitions, and again, we want to make sure we're creating a culture of safety, and we see a student or an employee without a mask, hopefully people are asking, hey, put your mask on or put your face covering on. Certainly there are going to be those that have the certificate to exempt them, and so how do we identify them? I would encourage you to work with each one of your principals to understand what that looks like on your campus. I know they all have creative ways about trying to make sure that we can identify people who have those certificates of exemption during the day. If someone is in your class that has a medical exemption, a medical certificate for a face covering, what do you do about that? So we're going to have to handle each one of those cases individually. And in many cases, maybe what we do is we work with your school administration to call their healthcare provider who provided an exemption and say, hey, what can we do with the student in school to help protect us all? The other thing you can look at doing is certainly positioning that student in the classroom so that we are maintaining 6 foot of space between you and other students in that class. So we're going to have to be creative in those situations, but we certainly want to handle each one individually and try to do whatever we can to protect everybody in that classroom. Again, really wrapping ourselves around that culture of safety. If you have students that just refuse to wear a mask, they do not have the exemption, our policy does cover that. What we're going to do is we're going to coach, we're going to talk to parents, we're going to talk to those students about making sure that they have that face covering on, because how important it is. But at the end of the day, if we have people who are just non-compliant, our policy allows them to be moved to a remote learning status, and maybe that would be a better option for them. So again, in both of those cases, I would encourage you to work with your assistant principal, your principal, to work through those situations with you. So we're going to transition now from PPE, and we're going to talk a little bit about what are some of the things that you can do during the day to make sure you are keeping yourself safe from COVID-19. So Susie, let's talk a little bit more about hand washing and how important that is.
Thanks, Jody. So there's a lot of information here, but it all translates to wet your hands, put some soap in there, lather up, and keep it going for at least 20 seconds. Sing that happy birthday song, sing the ABC song, rinse your hands. Do you pull the paper towels down before you start running the sink and washing so that you can just grab the paper towel afterward? Or do you use your elbow to turn on the automatic hand dryer? All little steps that you can take to mitigate risk of picking up viruses through the day.
Thank you, Susie. And you know, one of the things that I know some of this stuff seems very simple and seems elementary, but we really, excuse me, want you to model this behavior for your class, for your students. And again, if you sit there and you think this slide through as you're washing your hands, whether you're doing it in your classroom or the next slide, we're going to talk a little bit about hand sanitizer, you're modeling that behavior. And I think that as you think through your day, to create that culture of safety, you have to create spots within your program throughout the day that you're going to allow students to do this. That's going to take time, but we have to allow it to happen. So, Susie, hand sanitizer, how are we handling that?
All classrooms and workspaces have hand sanitizer available. If soap and water are not available, this is your go-to, okay? Our products do contain the 60% or higher alcohol that is required for it to be labeled a sanitizer. They don't get rid of all the germs. If you have really dirty hands, it's probably not the best go-to, but our students will be probably carrying some hand sanitizer from home, but again, we have supplies sufficient in the district as to use some sort of product to make sure that we can disinfect throughout the day at all times.
Thank you, Susie. And I think the other thing is make sure as you're entering, whether it's your office spaces, your classrooms, wherever your home base is on one of our campuses or one of our work sites, make sure one of the first things you do on a daily basis is check and make sure you got hand sanitizer in that area. If you don't, or if it's running low, please contact your custodian. We are making an extra effort on days to support COVID-19 cleaning continuously. In order to do that, we're bringing an additional custodian on days to help with some of this stuff. So please, there should be somebody there. If you run low, it should be stocked at night as your custodian cleans your room. They should be restocking. But again, if you come in, please, that's one of the first things you should check for, that you've got that full bottle of hand sanitizer for your day. So let's talk about social distancing again, because it's so important. We want to make sure everybody understands what that means. And again, in everything you do throughout your day, I think social distancing needs to be at the forefront of how you're designing your day and walking through that day with your students. So from day one, if you can start with, again, classroom setup is so important. Listen, I taught third grade for quite a while, and I know what you want to do is you want to decorate that classroom, you want to hang student work, you want to make it an interesting space, you want to have students collaborate, small group, but really what we need to do is rethink that mindset, and the best way to protect everybody in your class is to make sure that you are for as much as you can, getting as much space between you and your students throughout the day. And again, please look at your classroom when you get to campus this year. Please have anything removed that is not operationally essential to you. If you've got extra furniture, talk with your head custodian, talk with your principal about where we can store that for you. Or in some cases, maybe you can take it home for a while. But we really want to create as much space for student and student desks as possible. And if you can envision kind of when I went to school, the traditional classroom is teacher at the front, all the desks facing the teacher. In their rows. I remember a lot of my teachers used to put a little tape on the floor, and my desk had to line up on that exact space. I know times have changed, but that's really kind of the mindset we need to get back to. So push those desks as far apart as possible. If you need any help with setup of your classroom, your facilities manager, who your assistant principal knows and your principal knows, can come in and assist you with what we suggest that setup to be. Very, very important initial setup, that classroom, and that culture throughout the day. Certainly in lines and in hallways, you're going to have to make sure you're teaching your students to maintain that 6-foot distance as much as possible. We will have signage up. We've ordered sign packages for all the schools. So in hallways, you're going to see signs that say, keep to your right, maintain social distancing. So the more you can alert your students to read the signs, maintain that as they're moving through campuses, we're all going to be for the better. So social distancing, I can't say it enough, as much as possible during the day. Even if you can't maintain 6 feet, 3 feet's better than no feet. We want to make sure we're focusing on that as kind of our umbrella of our guiding principle as we move into the start of the school year. So Susie, I don't know if there's anything else you want to say on that, but that kind of is my big topic that we want to make sure we keep hitting on.
I think you got it. You covered it.
So, okay, so we're in school and we're social distancing as much as possible. We've got really great classroom setups. We're all wearing our PPE. We're wearing it correctly. It's going to be all hands on deck to make sure throughout the day we're doing everything we can to keep everybody safe. And so what we're going to ask you to do is help us. Again, I talked about we're going to transition an additional person from our night crew custodians to days. They're going to have assigned tasks, and both our day custodians on your campuses will be hitting high contact points, door handles, cafeteria handles, bathrooms as much as possible. That's going to be very, very important for them to do. But they can't get into every space. They can't get into every classroom all the time. So one of the things we're going to ask of you as we partner in this process is to help us keep your space disinfected during the day. In every one of your spaces, we have placed a bottle of our disinfectant. It is a green cleaner, but is a disinfectant. It works against coronavirus. And so we're going to ask you to keep using that through the day. We've got another video here that we're going to show you where it talks about some of the help that you can give us in your spaces.
On behalf of the Sarasota County School District, we would like to thank the teachers for keeping some common touch points clean in the past. But we need your help to clean a few more areas due to the COVID-19 pandemic. Our students depend on all of us to have a safe, clean learning environment. Always make sure to adjust the spray bottle to a fine mist, not a stream. Spray a fine mist on the 3 sides of the screen and desktop. Ask a student helper to pass out paper towels. Students should only wipe down the guard and desk they have been using. The cleaning solution does not have to be completely dry. It will dry in a few moments. Dispose of the paper towels in the trash can while maintaining social distancing. Please place the bottle of Alpha HP on your desk so it can be refilled each evening as the custodians clean their routes. Placing it on the desk helps the custodians find the bottle quickly. As needed and at the end of the day, we ask the teacher to remove the trash liner, tie it, and install a new liner. New liners will be in the bottom of the trash can. If there are no liners, please contact a custodian for extras. Please place the tied bag in the hallway. A custodian will come by later on and remove it. Remember to wipe any touch points in your room often. Custodians will be cleaning common areas throughout the day. This includes doors, handrails, elevators, and counters. They will also be around each evening to do a deeper cleaning of the classroom space. Again, thank you for helping to maintain a safe learning environment for our students.
All right, well, let me unpack that video a little bit. So you saw a lot of things there. So those are some of the items that we're asking you to kind of take a look at in your workspace. Again, everybody will have a bottle of Alpha. Everybody should have paper towel rolls. That'll all be replenished at night by your custodian when they come through your classroom. So again, when you come in during in the morning, that should be one of the things you check for. If you don't have it, call your day custodian right away. We are asking that periodically, certainly before class changes, if you're a middle school and a high school and you're changing classes before that class change happens, or at an elementary school where students are in your classroom all day long, several times during the day, that you take the alpha bottle, walk around. You saw the person walk around, the custodian walk around. You saw the desk shield. Again, we're providing desk shields for every student and every teacher in the class. We're asking that you squirt that desk shield and the desktop with the alpha, and then a student or a volunteer or a helper pass out the paper towels, wipe that desk shield, wipe that desktop, and you don't need to dry it. Actually, it's better to leave it a little bit wet. That chemical will have a little longer time to work against that COVID virus if it happens to be present on that surface. We're asking those to happen multiple times during the day. And again, certainly before a class change happens, we need to make sure that you are allowing enough time to allow every desk and every shield to be squirted down with the alpha HP, and for that to be wiped down with the student that's been using it for that particular period. While that's happening, please take the opportunity, if you've got a bathroom in your classroom, squirt that door handle with the alpha. Squirt the door handle to exit the classroom. Hit a couple of those additional touch points with that alpha and just wipe it down quick with the paper towel. We're asking that you use the paper towels and not rags, because again, we don't want cross-contamination. Use the paper towels and have them thrown out. So as much as you can do that in your spaces, we're asking you to do throughout the day. If you are in an office space, disinfect your phone, your keyboard. If you're disinfecting your keyboard, take your paper towel, dampen it with the alpha, and wipe it across the top of your keyboard. Continue to do that on those touch points in your classroom and in your office space as much as possible, and have students help you with those things. They should be wiping down their own desks and partaking in these additional responsibilities. One of the things that we know that as that happens in spaces across the district, we're going to generate more garbage during the day than we have in the past. So we're asking that either you as the teacher or the person in that office space, or you assign one of your students to look at that trash can. When it's getting full, please go to the trash can, tie the top into a knot, that plastic bag, and set it in the hallway. Custodians, those day custodians that we talked about, will be roaming those hallways throughout the day, again, wiping touch points. When they see a bag of garbage in the hallway, they're going to go ahead and pick it up. At the end of the day, we're asking you to do the same thing. Please don't just get up and walk out of your classroom. As you kind of close down and think about the day, please make sure that last class in there goes through that process again. They're spraying those shields for the night. They're wiping that desk off for the night, hitting those touch points, the door handles for the night. And please make sure, finally, before anybody leaves the classroom, again, take that garbage, tie it closed, and please set it in the hallway. One of the things that we know is that custodians are going to be really stretched to make sure they are hitting touch points every night, making sure we're turning those buildings around for you the next day and they're as safe as they possibly can be. Setting that garbage outside your doorway so custodians don't have to make an additional run through their routes to pick that garbage up saves a lot of time. So it allows custodians to focus on touch points and cleaning and being very thorough in your classroom if you set that outside. So that's how you can really help with just some of the daily activities in your area. So we appreciate you helping us out with those. Whoops. Susie, let's talk about what are some of the symptoms of the COVID-19 infection.
Okay, thank you. So we've had the slide up for a few minutes, and I suspect many of you have seen that there is quite a range. Those that cause us pause are a sudden loss of taste or smell, or a high fever, or respiratory distress, having trouble breathing. But outside of that, you can see that there are GI issues. I might have muscle aches. It takes a while sometimes for symptoms to develop. So again, back to the reason that we're mindful and say, I'm not feeling well, something just doesn't feel right, and we're not going to go into school that day. We're going to, and I think we talk about this in a little bit, do kind of a self-screening. And if at all we have concerns, we're going to stay out of school or work and watch to see if symptoms develop. That's that self-check we were talking about. Every day, every employee, every student should take their temperature, check for fever. A fever is 100.4 or higher. If you don't have a thermometer, no worries. We can look at symptoms. We can also look at what have we been doing the last couple of days, the last couple of weeks. Have we traveled? Do we know anybody that has tested positive, or a friend of a friend of a friend even? Just being mindful of what our daily routines have looked like. We definitely don't want you taking fever reducing medication if you have a fever and then going into school or work. So that question will be asked a lot. I mean, we have people that think, it's probably just that people get sick. Students get sick. Students on average, I'm told, can have up to 7 or 9 illnesses a year. Are they all COVID? No, of course not. It may be something else, but because COVID is circulating in the community, we're going to err on the side of caution and just take a step back and make sure that that's not what it is. So looking for symptoms, looking at what we've been doing, and if you answer yes to any of those questions, stay home, don't report to work, check in with your supervisor, and we'll talk about next steps.
Yeah, Susie, thank you. And let me just mention here, I know one of the things we're focused on in this particular slide is employee self-check, but understand, as we partner in keeping everybody safe, parents have to partner in that also. And so one of the things going home for parents is this same type of thing. We're asking them, again, we know the best way to keep people safe in our schools is to keep people who are sick out of our schools. That includes staff and students. So we are going to be asking parents, we're going to be sending home a checklist for parents. We're going to ask them to go through the screening process with their students every day before they get on a bus or before they drop them off, just like you're going to go through before you come in for the day, to make sure you're not coming in sick.
So again, some people are symptomatic and some people are not. But if you have symptoms, definitely stay home, call your supervisor. We'll talk about next steps. We have a process in place.
One of the things that I want to jump in here for a second and mention too is and I just want to highlight it is, information and communication. As we talk through the medical professionals, the epidemiologists, the infectious disease specialists, one of the things they're alerting us to is communicate. And we cannot control a potential case of COVID-19 that's gotten on our campus unless you communicate with us. So again, down in the left-hand corner, inform your supervisor is so important. Please, if you are staying home because you have a potential symptom of COVID, please call in, make sure we are aware of it and that we're tracking that. And so that if you do, God forbid, come down with COVID-19, we can make sure we take the appropriate steps on campus to contain that potential exposure. So that's so important. So what happens? We're partnering with the Department of Health in all aspects of how we've designed the start of school in this year and how we're going to function. So this kind of highlights that. So Susie just took you through kind of what happens if you're having symptoms, and we want to show you, if you are, what that looks like. So 2 forms coming from the Department of Health that we're going to utilize and we'll be partnering with them on. The one on the left is for students and staff. Basically, it's divided into 2 sections. And if you are feeling sick, at the top it talks about the different symptoms of COVID-19, and those symptoms are temperature of 104 or higher, sore throat, new uncontrolled cough, diarrhea, vomiting, abdominal pain, new onset of a severe headache. If you're checking a box in any one of those boxes. And then section 2 is super important. It talks about our community. Right now, our health department tells us what level of community spread we're in. They watch those numbers daily. We talk with them daily. Right now, we are in a situation where our community is considered high controlled spread. So that second section, we check a box there that says high controlled spread. If that applies to our community at the point that you're having this symptom and you've checked the box in the upper part of this form, what the requirement from the Department of Health is that you will be off work or you have to removed from campus for 10 days. And that's the same thing with a student that goes to the clinic where we check these boxes and it applies. They are required to be out of class, out of school for 10 days. If that happens to you, or if that happens to a student in your class, again, symptoms, not a positive COVID test, but we're just talking symptoms of potential COVID-19, then you got to be out for 10 days. In order to return from work prior to 10 days, you have to have a negative COVID-19 test. So there's potential you could come back sooner, both you as the employee and the student, but there would have to be a negative COVID-19 test, or your doctor or medical person would have to give you an alternative diagnosis for what kind of symptoms you're currently having. In addition to that, you, before you come back to work, have to call the Department of Health, and they have to give you a clearance to come back to work. And so that's the form on the right. It's an excuse letter, return to work, return to school. We are going to be requiring this of all people who have experienced COVID symptoms on our campus and are sent home for 10 days. Before you're allowed to come back to work or back to campus as a student or back to school, the Department of Health will have to sign this form, give it to you, and you'll have to bring that back with you on your return. So again, that's our process. We're partnering with the Department of Health, and it's really under their authority that we're asking you to isolate from campus, isolate from school, and then the process you're going to have to go to get back on campus, get back at work. And again, that's there. Again, we're creating this culture of safety to protect everyone in the school and work environment. Susie, anything I missed that we need to mention?
No, I think you got it. Thank you.
And again, just reiterating what I just said. So if you are symptomatic, again, the form on the left we just showed you, you're checking a box with one of the COVID symptoms. If we are still in a high community spread environment, then these are the parameters that you're going to fall into. Again, you got to stay home for 10 days. If, however, you get a negative COVID test in that 10 days, you could come back. If you get an alternative diagnosis from your doctor, you could come back quicker than 10 days. But in any case, either the 10 days have been up or you've gotten that COVID-19 negative, you have to call the health department and they have to give you that release to come back to school and come back to work. And that's what we're going to be looking for to allow you back on campus. So for staff that are on campuses that are healthy, this is a way of us helping to ensure that if people are sick, they get checked out before they come back and expose others to a potential issue. So we just talked about if you have symptoms, if you're at work, if a student has symptoms and they're at school and they've gone to the clinic, what's going to happen? Now let's talk about what happens if we have a positive COVID-19 case on campus, a confirmed case. We've got a process in place. We've got a video to start that process, talk about that process with you, and we'll start with that.
In our response to COVID-19, certainly one of the most important aspects of our being prepared to have students and staff return is identification of possible COVID-19 cases within our school and being able to contact trace as quickly as possible. We're in constant contact with the Sarasota Department of Health. They've been involved in our process from day one and have approved where we are at this current point, which is what we're going to roll out as staff and students come back.
We're asking parents and guardians to work with us as a team to make sure that all of us are safe. We ask families that if someone is sick, stay home. If we do have a situation on campus where a student presents symptoms similar to COVID, we will bring that student to the clinic and isolate them. We have evaluated our spaces so that we have enough room to isolate those students that might be symptomatic and keep an eye on them until their parents or guardians are able to get to the school and pick them up. If it turns out that we have a positive diagnosis, then the Department of Health, the administrative offices of the school district, the landings, and the school site will work quickly and thoroughly to notify families or anyone that is at risk or involved.
We've developed an online form that feeds into a database that all staff and students will be tracked on. As soon as symptoms of COVID-19 appear in a student or staff member, or a report of COVID-19, a clinic aide, a nurse, an assistant principal or principal will have access to the form. That starts our process. Back at the landings, we've got teams of people who are identified to respond to these reports. So some information gets input into that form. That report automatically notifies a team lead, a case manager. Our teams of response people are working with the sites to determine very quickly what that looks like in terms of exposure at a site. At this point, we will bring the Department of Health into the mix and we will discuss what's going on in this particular case. They will make determinations for us in terms of, does anybody have to be excluded from school? And if they do, for how long do they need to be excluded? Once that determination is made by our team and by the Department of Health, we will then communicate back to everybody involved in that case, whether it's students in a class, teachers. We will communicate directly to them in terms of, do they need to go home for 14 days? Do they need to stay at work? Do they make sure they're wearing that face mask? That'll all come directly from the team. In addition to that, we will have a communication that goes out to that school or to that department that identifies what's the case look like and make sure we're reassuring people that we have addressed it with everybody affected and we're returning back to business as normal tomorrow. If that changes, or if we have to close a classroom, if we have to close a building at a school, or if we have to close an entire school, we will be working very closely with the health department to make that determination, and we will communicate that out as soon as we have that information. A key factor in all of this is we're going to provide a list of common COVID-19 symptoms, and we're going to ask parents, please, if your student is experiencing any of these symptoms, don't put them on a bus, don't bring them to the bus stop, don't bring them to school. That's our first line of defense in making sure we keep students who do come to school and are healthy safe.
So that video kind of takes you through the process that we have to respond to a positive COVID-19 case, identified case on campus. Again, the slides we previously talked about is you're sick, you've got a symptom. In those cases, you stay home for 10 days. But this is a different case. This is potentially somebody on our campuses with COVID-19 positive. And it walked you through what that process is. And so in every case, it referred to a form. We have a link to a form that several people on every campus have. If there is a potential COVID-19 case, the first thing they do is fill that form out, whether it's employee or student, it doesn't matter. They fill that form out. That form comes into, we've got several, we're calling case managers identified. You heard me refer to that in the video at the landings. Those case managers then work that case. They work with the Department of Health. They work with the principal or assistant principal. They're going to be working with teachers. They're going to be working with parents. It's going to be a team of people to identify that truly we have a positive COVID-19 case on campus. And if we do, who has had significant contact with that positive COVID-19 case. And so, by significant contact, you can read through the slide here, it is coming within 6 feet for more than 15 total minutes cumulative throughout the day with the person who has a positive COVID-19 confirmed case. So that contact tracing is going to be critical. And what does that mean in terms of a classroom? So if I have, let's run through a scenario, and let Susie DeBose, who's been taking us through these slides with me and done a wonderful job, is one of our identified case managers. So Susie, please jump in where because she's been doing it live as we come up to the start of school and work these cases. So so let's look at a scenario. So we have, let's take a typical classroom where we've got, hopefully everybody's socially distanced as much as possible. Everybody's wearing masks. We've got a potential student who parent calls in and says, my student went home yesterday. We have had a test and we've got it back quickly, and that student is COVID positive. So that's notified to the clinic aide or somebody at the school. The school starts that form process, alerts the case manager. The case manager calls back to the school and starts to talk with, okay, let's talk with the teacher. Let's talk with the principal. Let's talk about what the contact from that student looked like over the last couple of days. And so we're going to be talking about, where does that student sit in class? How close were you to that student and for how long? How close are the students around that particular student? What did the cafeteria look like? Where were they sitting in the cafeteria? That's the process that those case managers are going to run through to hopefully quickly identify anybody who's had significant contact with that COVID-19 case. That's where setup of classroom, continuing to practice social distancing is so important. And so what that looks like is if this class has been doing a great job of that, then as that case manager, maybe Susie in this case, works with the Department of Health and we determine with the teacher what that's looked like over the last couple of days, with that student who has COVID-19 will be out of school, or if it's an employee, they'll be out of work for 10 days. They cannot come back quicker than 10 days. And then everybody that's identified as being within 6 feet for more than 15 minutes of that positive case will have to be excluded from school or from work for 14 days, okay? So that's the important piece. When it's a COVID exposure, there is no way to come back early. It's either 10 days if I'm the positive case, or it's 14 days if I'm one of the exposed people. And how am I gonna know that? Again, the case manager is gonna communicate that to the people who are affected, working certainly with your administration at your work site or on your campus. In those cases, we're going to talk about what that looks like later with leave, but if somebody is positive for COVID-19 and goes out for 10 days, or you're an exposed person and you go out for 14 days, we talked about making sure you saw the letter, the return to work note, that the Department of Health is going to have to fill out for you. In these cases also, that positive person or child and everybody that was exposed prior to coming back to work will have to be cleared by the Department of Health, and we will be looking for those to be brought back to work the first day or brought back by that student that first day back. When this is all going on, depending on the exposure, depending on what was going on in the classrooms that day, your case manager, Susie in this case, would let you know and would communicate what your return date is. And so we will figure that out, communicate what the return date is, but before you can come back, you got to have that clearance note from the Department of Health. So Susie, what did I miss? What do we need to make sure we need to say on positive identification of COVID and contact tracing?
Thanks, Jody. I'd like to talk a little bit more about days out, but I think a good point that you brought up is that we're going to need to work with our instructional staff, with our aides, with our administrators at the sites to identify parties that may be needing to quarantine. So maybe assign seats, or I'm not an instructional staff member. How do you keep track of the kids and kind of know where they are? That if I would say, Mrs. Smith, will you please give me your class roster and tell me who sits within proximity of little Joey? We're going to need to do that as a team. So those are things that we maybe want to start thinking about as we're setting up our classrooms. But I know it can get confusing. I know we talked about 10 days if I'm sick, and I can come back if I get a negative test or a doctor's diagnosis. That's sick. COVID's a totally different ballgame. COVID is, and let's use the terms, if you are positive, you are isolated. Isolated means go in a room, shut the door, you're wearing a mask if anybody drops off your breakfast, lunch, or dinner, and you're not mingling with the rest of the family. Many of us have kids or significant others, or maybe our parents live with us. You've got to stay away from those people, because if you do not, then they're quarantined someone who comes in contact with a positive. Quarantine is 14 days. Their 14 days starts on the 10th day of the positive. Does that make sense? Let's think about this. I am positive, I'm out 10 days. I didn't wear a mask in the house. Everybody continued to mingle. They were supposed to be quarantining for 14 because they came in contact with me, but no one wore masks and stayed away. So their 14 days starts on my 10th day. If that doesn't make sense, feel free to reach out to me. I know it can be a lot, but please know that the contact tracing team has developed some traction in this area. So we want to be a resource for you. And we don't make the final decisions here. We work with the Department of Health in all cases so that we're sure that we're working with the experts, the public health professionals that will help us figure out who's going to go home and maybe go remote, who's going to be able to stay in the classroom setting.
Thank you,
Did I miss
Susie.
anything? Okay.
Yes, thank you, Susie. So, am I echoing?
I don't think so. Not to
Okay.
me.
Okay, so in these cases, if you have any questions, your administrative leader on your campus, your principal or your supervisor, know who your assigned case person is, and so they can give you that name or they can communicate back with them if you have any questions. A couple things about communication. We are going to do our best to communicate with everybody involved in this contact tracing. So in the case that we just went through with the student in the classroom, we will be communicating directly, or the case manager or your AP or your principal will be communicating directly with everybody involved. So the students in the classroom, the students certainly that have been in close contact with that case, certainly the teachers that have been involved with that student. We're going to communicate details on the case, and you'll know what's going on, and you'll know how you're affected. When you are affected, you're also going to get a letter from the Department of Health that explains how long you have to stay out. So the Department of Health will also make sure we're producing that letter that explains that. And again, before you come back to work or before that student comes back to that classroom, they're going to have to get the clearance from the Department of Health. Now, I want to talk a little bit about communication to other classes on campus. So, it's not if we're going to have a COVID-19 case on campus. Certainly we know it's in our community. We probably all know somebody that's had COVID-19. It's just when it happens. And so when it does happen, it's our goal to respond to these cases, contact trace as quick as possible, make sure everybody knows if they have to be excluded, what that looks like. But then there are all the other people on campus that aren't involved in this particular situation. So let's say this is Sarasota Middle School, and this happened in room 712, building 7. So everybody involved in this case will know exactly what's going on. But then you're going to have people in building 8, in building 9, in building 10 that have had no contact with this student, are not affected by this case, but are at that school site. So how are we going to communicate to staff at the school that aren't involved in the exact case, and to parents and students who aren't involved in the exact case? As all of these notifications are happening, we have somebody from our communications department working with your principal to make sure we are putting out a Connect Ed, an email, social media, to assure everybody on campus that, hey, we want to acknowledge we had a case today on campus, and we will divulge as much information as possible. We cannot divulge names, we can't divulge classrooms, but we want to make sure we say, listen, we had a case, and that everybody involved in that case that was a potential exposure has been vetted through the Department of Health, and they have been excluded from campus, and that everybody else is safe to return to campus. So we will communicate with everybody else who's not actively involved in that case as much as we possibly can. But please understand, it won't be the details in every case, because by HIPAA and FERPA, we just can't communicate that unless you're actively involved in that case. So we will work with you, and we'll answer questions, and we'll try to communicate as best we possibly can to make sure everybody stays as well informed as possible. Susie, anything additional?
No, thank you. You covered it.
Okay, all right. So one last time, just to confirm. So employee, we have a positive case on campus. We're going through the process that we just described. If it's an employee or if it's a student and they got positive test, they go home for 10 days. They have to isolate for 10 days from the date of the positive test, onset of symptoms. Okay, and they have to continue to isolate for 10 days until the 10 days have passed, and at least 24 hours have passed since the resolution of fever without the use of fever reducing medications, and other symptoms have improved. And so in these cases, that's why, in assurance for everybody else who's still healthy and sitting on campus and continuing what they're learning and they're teaching, that's why in every case, no matter what it is, the department has to clear the person to come back, because these are the types of questions they're going to ask them. When somebody's been isolated for 10 days because they got COVID, The Department of Health is going to ask these questions. Are your symptoms improving? Has your fever been reduced? And only then, and if then those are okay and those have been approved, then they'll get that release from the Department of Health to come back. So again, I think that Department of Health is really going to make sure that that last check and balance is in place before somebody comes back to one of our sites. And then the last bullet there is no requirement for a negative test when you've been COVID-19 positive or when you've become in contact for a COVID-19 individual, that you have to test negative before coming back. Again, the requirements are the days out, the 10 days if you're positive, the 14 days if you're the contact, and then the approval by the health department to return. Susie?
Yep, I have a comment, please.
Go for it.
Because we've been tracing for a couple months now, a few cases, and coworkers will question why staff are coming back on XYZ date when they're supposed to be out for 10, I thought, or 14. Again, it gets confusing. You can trust the contact tracing team working with DOH that we're looking at the calendar, because we do not require a test-based strategy to return. Let me give you a scenario. I'm not feeling well on Monday. On Tuesday, I decide to go get a test. I don't get my test results back until Friday. And that's a fast result, sorry. Sometimes it takes a while. So when I'm looking at the 10 days for my case, it's at symptom start, which is Monday. It's not necessarily the test date when I got the test results, it's when symptoms started. So it's either 10 days from symptom start or test date. Not when it came in, test date. Remember, I got the test on Tuesday. If I'm confusing you, again, don't hesitate to ask questions. I'm in email too. Some people are asymptomatic and they may decide, because testing's available at Robert L. Taylor, to go get a test. In those cases, it's pretty straightforward for us. Your 10 days starts on your test date. Let me throw out another situation. My son has a roommate. My son's roommate was diagnosed positive. Thankfully, they were smart, isolated the roommate right away, put him in a back room, dropped off the dinners. Now my son had to quarantine for 14 days. He said, "Mom, I ran out and got a test right away and it's negative. So I can go back to work, right?" No. If you came in contact with a positive, you are quarantined 14 days, period. Let me say one more thing about symptoms, because you see that, okay, I'm doing my number of days and I don't have a fever. I haven't had a fever for 24 hours, but I still can't smell anything. Or, I'm a little tired. I'm a lot tired. I'm lethargic. That's when we need to work with our supervisors to determine if it's really time for us to come back to work. If you've lost your sense of smell, if that hasn't come back yet, but you're feeling okay and you want to go to work, you can go. You've met the requirements for the isolation period. You've met the requirements, for being a positive case, being out long enough. But if you're lethargic, still having symptoms, still having trouble breathing, that might require some guidance from your provider. And again, we'll work with your supervisor to figure out when you're coming back.
And again, Susie, let me just jump in. In those cases, the clearance has to come from the health department and you have to have that release to come back to work, right? So again, whether it's us or the health department, we're going to work with you on those things, but you're going to have to, in any case, you're going to have that release from the health department to get back to work. Okay. So we're in one of these situations and you either have COVID-19 and you've got to be out to 10 days, or you've been in contact with somebody close enough for long enough that we've told you you've got to be isolated for 14. What does that mean for me as an employee? So Al Hareda, he's our HR expert. He is going to talk and in charge of all things leave. Al, are you there? Can you talk a little bit about this slide in terms of available leave and options for employees if they have to be out?
Yes. So thank you, Jody. So the Family First Coronavirus Act does allow for, if you are out, if you've been quarantined based on the case manager's decision, you can receive a maximum of 10 days of full duty pay while you are out, not to exceed more than $200 a day or $2,000 over the course of the 10 days. So that does not have to be used all at once. Say you came in contact or you're not feeling well because you came in contact and you suspect that you may, that you're not feeling well, and you suspect that you may, like Susie was saying a few minutes ago, you're just not feeling well, but within 2 or 3 days, you are feeling okay, you've met all the requirements to be allowed to return, then you may opt to use 2 or 3 of those days because you were consulting with a physician about what your signs and symptoms were. So it doesn't need to be all used at once. However, remembering that there is a maximum of 10 days. So if you have a situation where you came in contact because what we're asking and what we've been talking about is the culture of being protective, the culture of wearing your masks, the culture of social distancing. But if you've had another, say you've used your 10 days, and then you have another situation where the culture, wasn't of social distancing, wearing your mask within being near somebody who tested positive. The second, you wouldn't be able to be covered for 10 more additional days. So it's very, very important, we've been talking about making sure that you're wearing your mask, making sure that you're practicing social distancing, because this Family First Coronavirus Leave Act only does cover the 10 days. And this is set to expire December 31, unless there's an extension on that. So this flow chart is used because, as we've talked about, a lot of this is a little confusing to people. So this flow chart is also located on the Family First Coronavirus Response Act page on the HR website. But basically what it goes through is what we're focusing on now. Would be number 1, which is the your quarantine based on one of the reasons that the case managers have advised that you're quarantined, or number 2, that the health department has quarantined you based on one of the reasons of coming in contact with somebody or someone's signs and symptoms. The other ways that you could qualify is actually if your child's daycare or childcare facility is closed or schools are closed. That would require, you would have to submit just something saying that that's closed. We would obviously know if our public schools are closed, but we wouldn't necessarily know about your private daycare. Remembering part of that is that they are closed, not that you're choosing not to send your student to school or to their daycare. And if you did meet one of those requirements, it also is for the 10 days of the full pay, $200 up to $2,000. The next slide, we're going to talk a little bit about an exception to the child care. So there is a extension to FMLA for child care reasons, and that's, again, if you are choosing to keep your child home, this does not apply. But if your child care agency is closed or your schools are closed, then you could apply for up to 10 additional weeks at 2/3 pay for taking care of your child while at home. And again, both of these are located on the website. And if you have any questions, because it can be confusing, please just feel free to give me a call.
Thanks, Alice. Let me just jump in on a couple things. In terms of our process, our COVID-19 tracing process, if you are identified, if you're an employee and you're identified as being one of the people that either has the COVID-19 or has been identified as a contact of a COVID-19 person and you have to self-isolate, our process built into it has a notification that goes to HR. So if it's Jody Dumas and I'm contacted by my case manager and my case manager says I got to be out 14 days, HR is going to be notified of that, and then a person from HR who specializes in leave will make a call to me, the employee, to Jody, and talk through my options. And again, this COVID-19 leave, this 10 days, or the extended FMLA if your child and their place closes down. But this is one of the options. And so let's talk about what that might look like. So if let's just say I'm a potential contact, I've been told I got to go home for 14 days. My case manager has just told me that. In the background, that information's flown to HR. HR person's going to give you a call and say, okay, Jody, we know you got to be out 14 days. Here are your options. And so you've got the federal leave that we just talked about that gives you 10 days of paid leave. But then the other option that's available, and this is not for everybody, but for people who can work from home, and this is only for people who go through the COVID identification process and as a result have to isolate from that. So again, the case manager would have told you that. In the case of, if I'm a teacher, let's take a teacher for example. If you're not sick, or if your symptoms are very mild and you can continue to work from home, that's the conversation that the HR, you, and your supervisor will have. We want to encourage you to work from home if we can make that happen for you. So if I'm a teacher, we're putting cameras in classrooms. We've got Zoom capabilities. There's Blackboard that's being developed to make sure that you can access stuff online. Our hope is you would just continue and transition to work from home and Zoom into your classroom. Now, we'd have to provide coverage in that classroom for all your students that are still there, but you don't have to use this 10 days if we have that option available for you. So first and foremost, if you have to isolate for some reason for a COVID positive case or contact tracing, we want to work with you to try so you don't have to use that leave right away. We want to try and allow you to work from home. And so your supervisor will work with you on that and how all that might look, but that's option number one. For some employees, let's take a bus driver, for example. There's potential that a bus driver gets exposed to COVID-19 and has to self-isolate. They're not going to have the option to work from home because you just can't drive a bus from home. So they'll have to use that Corona first virus leave right away. So options are work from home if we can make that work for you. Option two would be accessing the first Coronavirus Response Act leave, the 10 days. If that's all been expired and you used your 10 days, then unfortunately there's no other option. You would be looking at using sick time or some kind of accumulated leave time to take care of that time you're out. So that's kind of where we are. The big thing is I want you to know is there's options, and HR will be contacting you to talk through what works best for you and your site you're working at.
Correct. And
So
Jody, I just want to add that the work from home option, we would be working with your supervisors in order to figure that out. But remembering, and Jody, you mentioned it, I just want to reiterate that those would only be an option for the if we were quarantining you based on the case manager's decision. So with that being said, it's not an option if your child's daycare or school is closed. So it's not an option for the FMLA portion of childcare. It's an option for the two reasons that you would be quarantined or isolated based on our case managers.
Yeah, perfect, Al. A great clarification there. And then the other thing to realize is if you, let's just say that, excuse me, it was as a result of COVID-19 that you were asked to self-isolate. Let's just say it was 10 days and we could work that out and you weren't sick, so you could teach from home. We were able to get you zoomed into your class. We covered your class. You did your 10 days. Once your 10 days is over, we expect you to come back to work into your classroom or back to your position once that isolation period is up. So again, hopefully we've got the identification team in place, the case managers to work with you if we have these on our campuses, and we know we will have them. It's how quickly we can respond to them. And then two, HR professionals who can work with you and see what's best in terms of the leave that's available and how that all works for you on an individual basis. Al, anything else?
No, I think we got it.
Okay. So let's talk a little bit about once school starts. So again, we've talked a lot about this culture of safety, social distancing, kind of we're all pitching in as a team to make sure throughout the day we're disinfecting spaces. We're kind of self-policing one another to make sure we're all paying attention to what's important. School safety teams. These were established last year at every site. So we were talking, there were groups of people from every cost center, every school sitting down and talking about safety on campuses. And over the last year, hopefully, you know who are the representatives on these teams. Maybe you're one of them. And you've been involved in talking about what is What does access to campus look like? What do lockdown drills look like? That's really what those teams were focusing on. We're asking those teams to kind of expand their scope of responsibility this year. And one of the things we want them to do is make sure when these teams meet, and they should touch base with your principal or administrator at your site, they should be meeting very quickly after the start of school. We want to talk about COVID-19 response, safety protocols, everything that's going on with this culture of safety at your particular site. We want this team to take a look at that. If there are things that are working, we want to reinforce that. If there are areas on campus that are catch points or congregation points, this team should be talking about that and how do we address those issues. So this should be a way this team should meet and should talk about COVID-19 safety protocols, what's working on campus, what's not working, what adjustments do we need to make, and maybe what do we need from the district? What's the district not providing us that we may need? So please make sure you know these teams, you know the representatives from your sites that are on these teams. Bring your concerns to them and make sure they're discussing these concerns very quickly at the start of the school year, because these are ways to make sure we're vetting and controlling processes, and we're doing the best we possibly can for everybody throughout our district. So we're going to be talking a little bit more about resources. I did miss one thing, and before we transition, we're going to ask Lynn to step here and take us the rest of the way through some of the presentation. But before I do that, there's one thing I missed. I should have talked about back when I was talking about cleaning of classrooms and cleaning of spaces and custodians and responsibilities and what everybody's doing. I just want to also talk about one of the products that we're bringing in to the school district, and we will be starting next week. So as you transition back onto campus, once you go home for the day, we will have teams at night working on this. We have purchased an antimicrobial spray, and we will be spraying that on all touch points in all of your campuses, all desktops, door handles, cafeteria tables. We'll be spraying that across campus. What that provides is an antimicrobial layer of protection on all surfaces for a period of 90 days. And at a microscopic level, what it looks like is you don't know it's there, you don't smell it, it's very safe. It's a safe product. You don't have to worry about touching that table after it's been sprayed and dried. But if you could look at that table at a molecular level, it looks like just a million spikes across the top of that desk at a molecular level that are kind of sticking up. And the technology is that as droplets of virus are possibly spread on a campus or in a room or wherever it might be, they are falling onto surfaces. Those spikes puncture those droplets, and when those droplets, the outer ring is punctured on the virus itself, that virus dies. And so we have purchased that product. We'll be spraying that. We'll be respraying it again, probably around 60 days. But that's our added measure of protection that, cleaning's method one, but if something gets missed, something wasn't sprayed, I want everybody to feel confident that we've got all of our surfaces sprayed with this antimicrobial, and that's providing an extra layer of protection when we need it. So I missed that and wanted to make sure I brought that up. So resources on our district website. So Lynn, do you want to talk a little bit about other programs available for employees as they come back to work?
Sure, thanks, Jody. So the district has a lot of resources. This page is just highlighting a few. If you've already been to the district webpage and the homepage, it highlights the return to work and the return to learn. And those, you can click on those on the homepage and read about everything, the protocols for returning to work and for our students returning to school. We also have on the district webpage all the FAQs. So there's been, the communications department has put together a lot of questions that have come in to the district on one area that everybody can refer to. So we encourage you to go there and take a look, just so that you can take a look at what other questions you may have that may have already been answered, and you can obtain the answers on that page. And the school plan. So the school district has an approved plan with the state. That plan is also out on the district, so you could take a look at that. And the school board policy too. You may want to take a look and read that emergency policy. It may be changed on the 18th, so you may want to keep abreast of those changes. And, you know, in this environment where it's uncertain and probably just a lot of stress and anxiety for all of us, especially for, you know, the teachers coming in an unknown environment with the students and what's they're going to face. We have wellness, employee wellness, as you know, but we focused a lot last year on the mental health and all of the available resources. And if you go out to the employee wellness page on the district, you'll find just a lot of resources for you to help you, not only physically, but, you know, there's meditation, there's different things out there on that page. So we encourage you to go ahead and go out there and take a look at that. And then most importantly to everyone, I think, is sometimes underutilized is the Employee Assistance Program. This is a free program to all our employees. And you can see on the screen, you can call them, and you can also go on their webpage and just log into our site, and resources there, not only just for maybe you want to talk to somebody, you have 3 free sessions with somebody, you can certainly utilize that, but it also goes into some legal. Maybe you need some legal advice, or maybe you just need some financial information. There, it runs the gamut. So we encourage you to go out there and take a look at all those free resources that are available to you. So this page is just highlighting all of that for you. And the district, obviously, if you look at the HR page, has a lot of resources that Al referred to for the leaves and everything. So utilize what's out there. Your benefits are out there on the risk management employee benefits page. So just remember that you have all of that to go to, and the district, all you have to do is put a little search in the search engine, the little search bar, and you'll find what you're looking for. And it's easy access. And this next thing is a new employee online training that we're bringing to the district from Safe Schools. It has hundreds and hundreds of programs, and we have highlighted some safety programs that we want every employee to take. And it is, you log in with just your A number and your last 4 of your social, and these courses are going to be preloaded for you. You'll go in there and you'll start your course, and it'll be different modules. Each course takes anywhere from 15 to 40 minutes to finish, and it's very engaging. There's lots of videos, walks you through it real nicely, and it does ask you questions at the end of each module. So there may be 3, there may be 5 different modules for each topic, but these are ones that we are highlighting this year. And you also have access, if you want to continue to learn and be safe in all areas, you can go into the library and you can take a look at any of the trainings. All our employees have access to all that training, and you can go in and take those. And I certainly encourage you to do that. These are the only ones that we're preloading for you, that we were making them required, but there's a lot more in there for you. So we hope that you will go out there and take that. It's that culture of safety. That's what we are trying to really resonate throughout the whole district for everybody in all different ways. So this is going to help everybody with that.
So Lynn, let me just add, so in terms of the structure of your day today, we worked very hard with your supervisors and with Dr. Kingsley and her team. So I know this has been the beginning of your day, kind of return to work under COVID-19. After this presentation is complete, then the general ethics in the workplace, the sexual harassment, the workplace bullying, and the workplace injury prevention will kind of be your afternoon. And so we're asking that these are the videos that you'll watch this afternoon. So Lynn, how do they actually get there?
So this is how you get there. Your agenda that you'll receive will have the link, and you'll link out, and it's very simple. You just put your A number in with the A and the last 4 of your social. If you do have trouble getting in, maybe you're a new employee, we are loading every employee in the district, but there are glitches where maybe somebody gets left off. So just certainly email me. I'm in the directory, Lynn Peterson. So email me if you are having trouble, and we will get you loaded right away.
All right, well, thank you, Lynn. And again, those are classes hopefully you'll be looking at this afternoon, and those are self-paced, and so you can work through those in your afternoon time. There is one additional training that you're going to take in the next few days, and it's a result of some policy changes that we've had in the district regarding equity. And so, Al, if you would jump back in and talk a little bit about our equity training that they'll do over the course of the next couple of days.
Great, thank you. So every year we do our annual equity update, and our policies and procedures have been consistent over the past couple of years. So many of you know them. So you know that in the past, during your welcome back week, you've had to sign off that you've reviewed the policies and procedures for this school year. And then lots of times during your welcome back week, your principals or assistant principals would embed that into some of your training that happened that week with the slides of what is harassment, what our procedures are, how do you report harassment, what has to happen, those kind of things. So what we did this year was, out of a result of our board recommendation, as well as some new federal guidelines that have come down from Title IX, we outsourced a revamp of our policies, procedures, practices to what's organization called the Krell Associates. So Krell Associates came back with a lot of recommendations that were adopted by our board. So the way that we have addressed equity discrimination in the past have been beefed up. We put some clear-cut points in there, we're developing some forms that will be available for you guys next week that'll be a lot clearer, hopefully, some clearer definitions on what is discrimination, what types of discrimination, a clearer definition of our discrimination, our anti-discrimination policy, and then a very, very beefed up description of how we will investigate and what we'll investigate, and the what people should get out of the investigation and their possible appeals process. So we were trained on this procedure the past couple of days. So you guys will be, over the next couple of days, like Jody said, you guys will be watching one of our trainings. So you'll be watching the presentation on that. That will be your annual equity update. Then you will be signing the forms that you normally would sign to go into your site file, saying that you did have the training. With that, one of the things that I think are really neat about it is we are going to identify equity officers in each site, including our district-based sites. And that doesn't mean that will be the person who does the investigation, but it will put a clear face to who do you report to in your site. There's that one person, so it's not, do I report to this person, do I report to that person? There's going to be somebody designated in each site, each school, in each district office or department, that is who you go to report any type of discrimination or harassment to. So that'll be coming out on your normal emails to all users, and you'll be getting that training during your welcome back this coming week.
Okay, thank you, Al. So at this point, I think that concludes our presentation. At the bottom of this page is a website, an email that you can email questions to. So one of the things that we know as we were going through this, and we talked as a team about it a little bit, we may be generating more questions than answers in some case, and that's absolutely fine. So take a look at this email address. We will monitor this email address. If you got any questions as an employee about this presentation, about how we're handling leaves, about how long I'd have to isolate if there was a COVID-19 positive case in class, whatever that might look like, or questions about the training that Lynn and Al talked about, please email us on this email address here, and we'll get back to you as quickly as possible on that. Listen, I want to thank Al and Lynn and Susie for working with me on this presentation. Lynn has actually been the one that's doing the dirty work and getting the presentation put together. So Lynn, thank you to you and Susie for doing that for us. We really appreciate it. Here's what we hope. that we've at least provided you enough information to make you feel comfortable about what's going on in the workplace regarding COVID-19. If there's something we missed, if there's something that we're not doing that you think we should, please send us an email. I mean, again, back to our start, you know, this is a team and we don't know everything. Certainly we're trying to do the best we can, but we're not boots on the ground every day. You guys are. And so if you see something, hear something that's not going right, that we should be addressing that you think we're not, please let us know about it and we'll do our best to get that done. Let's talk a second about next steps. And so we're not going to leave you hanging here. We're not done. And so over the course of the next week, certainly as you come back and before students come back, we will be providing additional updates. And so we're going to break down some of the information we gave to you in terms of one-sheeters. So what does it mean if I'm sick? What does it mean if there's a COVID positive person in my classroom or on my campus? We're going to break that up a little in a clearer fashion for you and provide some informational one-pagers. We'll post them on our website. We'll send them to you via email, and just trying to make sure we communicate as much as possible to clarify questions about how we're handling things in this COVID-19 environment. So I want to thank you for spending your time with us. We certainly appreciate it. Again, we're all in this together, and if we could just get one thing out of this presentation, and we're all referring to, you've heard us all mention to it, it's we're trying to create this culture of safety, and then the safety net starts with social distancing as kind of our umbrella. We need to think about that in all of our activities. And then PPE is next, certainly in line with that. And we need to make sure we're all supporting one another as we move forward. So thank you very much. Thank you for the team. We appreciate it. And with that, I'll conclude the presentation for today.
Thank you.
Thank you.
Thank you.